Good day, my dear students. Welcome to our classes on chips and game for rats. This is a peculiar and a slightly different chart that I have displayed. A little sensitive and definitely it is worth its weight in gold. We shall be trying to find out what each one of the pictures means. Normal things first. Whenever we talk of vegetations, they can occur in any part of the endocardium or the valve leaflets. But we are more bothered about the valve leaflets for obvious reasons. Now, this is a normal tricuspid valve that I am seeing. Look at these. They are quite flimsy and translucent. They are allowing the light to pass through. At the same time, when they close, the leaflets oppose each other so that there is not even an iota of space in between. That means they are totally competent. So this is important. The same thing is shown over here. So it is the pulmonary valve, then the aortic valve, the tricuspid valve, and the mitral valve. This is a schematic picture which you people can appreciate and draw. So the normal valve leaflets we have seen. They can oppose and they are slender, feathery. At the same time, they are totally airtight. Whenever we talk about the vegetations of the heart, these are the classical diseases we must remember. Always first things first. And when I say vegetation, these two are of prime importance. One is rheumatic heart disease. Two is infective endocarditis. Third one can be non-bacterial thrombotic endocarditis. And fourth one is Liebman-Sachs endocarditis. So I shall be dealing with these two in detail. Before I go to the next, I would like to mention the importance of these. Non-bacterial thrombotic endocarditis can occur in conditions such as severe cachexia or malignancy, or it can be disseminated intravascular coagulation. It is also called merantic endocarditis. The vegetations are about 1 to 5 millimeters and they are separate from each other, found on one side of the valve leaflet. So that will be NBTE. The next one is Liebman-Sachs endocarditis. If you put it the other way around, it is SLE. So SLE, all of us know, and Liebman-Sachs endocarditis occurs in SLE. Here the vegetations are variable in size. Again, 2 to 3 millimeters to 5 to 6 millimeters, found on either side of the valve leaflet. But in both of these conditions, not much of destruction of the valve leaflet is seen. So for the sake of completion, we shall be mentioning these. But we will have to describe the rheumatic heart disease and the infective endocarditis vegetations in detail. I am not going into the diseases per se. So the first one we shall be seeing. Rheumatic heart disease. And incidentally, for this particular chart, these are my sources of references. Let us concentrate on the vegetations. Compared with the previous one, I would like you people to kindly compare. This is a valve, cusp, or a leaflet. This is also so. But here, I am finding that it is thick and opaque, whereas here, it is thin, slender, and translucent. So, there is an opacity of the valve leaflet, but more important is along the lines of closure of the valve leaflet. The words are very important. I am able to see a beaded appearance throughout the lines of closure of the valve leaflets. They are formed of fibrin and hardly much inflammation in rheumatic heart disease. It is an immunological disorder, we all know. Your books will be mentioning it as friable, but then kindly use the word firm. My professor used to say, you can pass on the specimen from one student to another without the vegetations getting damaged, because they are so very firmly adherent, small, 1 to 2 millimeters along the lines of closure of the valve leaflets, not above, not below. The classical histological hallmark of it will be the hash of nodule. See this one. This is the normal myocardium, within which I am able to find an oval or a ovoid lesion. And this is a higher magnification of the same. I am able to see large pale cells. Maybe they are modifications of the macrophages, histiocyte-like cells. And they are called the Anishkov cells. The entire structure is called the ash of body. Some of the cells have got a wriggling pattern of chromatin, which is called a caterpillar-like chromatin. And they are called the Anishkov cells. Look at this over here. You find that the chromatin is in the form of a caterpillar. This is a picture of a caterpillar, and exactly it resembles this. The entire lesion is called the ash of body. And this is a schematic picture of the same, which you people can draw. So these are all the Anishkov cells or the ash of giant cells, and there will be a wriggling pattern of the chromatin. These are all the normal myocardial fibers. Sometimes we will be finding a fibrinoid necrosis within this. So oval in appearance, Anishkov cells, caterpillar-like chromatin, fibrinoid necrosis. Please remember these. After having completed the rheumatic heart disease, I am going to infective endocarditis. Infective endocarditis, it is not bacterial. It can be bacterial, viral, fungal, etc. So it is called infective. Earlier it was called bacterial endocarditis. I will not go into the theory, but look at this one. I am able to see large, friable, hemorrhagic vegetations which have almost destroyed the entire valve cusps or the leaflets. Sometimes they can cause perforation, or even a ring abscess can be formed around these vegetations. So they are large, they are friable, they are reddish and hemorrhagic. This is what I see at a low power magnification. So this is the fibrin that is getting deposited, and these are areas of necrosis. There might be some inflammatory cells also. And all these dark blue irregular structures are bacterial colonies. So this fibrin is covering the vegetation. Therefore, the bacteria will not be released that easily into the bloodstream. When I do a blood culture, it will be negative. So we are supposed to repeat it. And this is a higher magnification. I am able to see the fibrin. The bacterial colonies are here, and these are the inflammatory cells. Look at this irregular nuclei. They are the neutrophils. It's a beautiful series of pictures. I hope you people will be able to draw them. And what is here for us? So this is the normal valves. The pulmonary valve, the aortic valve, the tricuspid, and the mitral valve. And this is the normal valve. When there is a stenosis, it is becoming thickened, it is becoming irregular. It is not able to close, it is not able to open also completely. My professor used to say, usually stenosis and incompetence go hand in hand. So this is a normal valve which is closed, whereas When this fellow is closed, there is an opening seen. That is why it is called incompetent as well as stenotic. I hope you people will be able to draw these diagrams in your theory papers. And coming to the complication of the rheumatic heart disease, I find that they become fibrosed, stenotic. And look at this one. This is actually the ostia or the opening of the valve, which is compressed into a slit-like space or a fish mouth-like appearance. We call it a buttonhole stenosis or a fish mouth stenosis. Classical is the opacity of the valve leaflets. And if I were to search for it or in the adjoining atrial appendages, I will be able to find the ash of nodule, which is supposed to be classical of it. So in this particular class, we have covered the ash of body, the rheumatic lesion, what are the vegetations in infective endocarditis, how this entire thing can be a chart, your short note on vegetations, what are all the various multiple choice questions that can be asked, and viva voce. And please be careful, both of these can come as essay questions, and you will have to go back to R.A.T.S and GAME. Robbins is a wonderful source of reference. Thanks to Edwin and Wikipedia for the pictures provided. Welcome once again to the class on charts. We shall be continuing.